After a contract dispute between a major hospital system and an insurer disrupted care for 60,000 patients, state regulators are now working to change the law to better protect patients. The falling out between UnitedHealthcare and Johns Hopkins wasn't just an inconvenience. For WMAR2 News employee Julie Wigley, who lives with multiple sclerosis, it meant all new care teams.
So my team that I've been working with since 2010, I had to say goodbye to and move on and find all new doctors, move appointments. I did qualify for continuing care, but continuing care was only 3 months.
Beyond finding new doctors, she needed new approvals for treatments.
Originally, I got denied at first through this new hospital, new service. We were able to sort it out, but I started making calls probably in September once I realized that this was permanent decision kind of happening, so I had to have a backup plan.
Those denials, along with short notice and confusing guidance, are why the Maryland Insurance Administration introduced new legislation.
This bill is absolutely, I think, all the tools in the toolbox we wish we had legally after the Johns Hopkins United dispute.
And it does several things, like requiring insurers to give earlier and clearer notice to patients and the state when contracts are ending. It would create a 90-day special enrollment period for people who buy individual insurance, though it would not apply to employer-sponsored plans. And it would require 90 days of continuity of care, in most cases automatically, without additional paperwork.
This legislation is important this year because I do think there are national dynamics happening that could come and hurt our market in Maryland. There's a lot of changes to federal funding for healthcare across the board, and so as resources shrink, that's when we start to see parties have these kinds of disputes.
And with no timeline for when UnitedHealthcare and Johns Hopkins will return to the negotiating table, the commissioner says protections like these are needed to keep patients from being caught in the middle.
Living with a disease that you trust your providers, you trust the doctors, you trust that friendly nurse that you see for the infusion center that you go into, to then kind of have to uproot that and find a whole new trust. It's there, but it's that process in, again, a disease that you're supposed to not be stressed. A hearing on the Senate version of the bill is scheduled for next Wednesday at 1 p.m. I'm Mallory Safaste. Follow for more consumer updates.